I'm no longer surprised that when I ask the men that I see in my office what sort of testing or workup was done to figure out the potential causes of your erectile dysfunction, almost all of them just look at me with this perplexed, quizzical stare and say, "What do you mean workup? Tests? There were no tests done. I walked in, said I had problems getting erection and having sex. I walked out with a prescription for a blue pill, and that was it. And it doesn't work, and so now what?" Well, the reality is that although most patients have a vascular component of erectile dysfunction, to assume that that applies to everybody really misses an opportunity to really impact and change someone's life. And so I wanted to present some potential options for testing, including blood work and other testing that can be done to really figure out, the cause of erectile dysfunction, particularly in a man who has not had any success with the typical or traditional medications that are taken by mouth. And so the vast majority of patients will benefit from at least some basic testing, and that includes thyroid function, which would include a TSH, free T3, free T4, and LH, prolactin. These are all hormones. Bioavailable testosterone, and SHBG. SHBG is sex hormone binding globulin. Basically, it's a protein that goes around in the bloodstream and gobbles up loose hormones, and it has a definite role in determining whether or not testosterone and other hormones are bioavailability. DHT, or dihydrotestosterone, DHES, which is a storage form. Cortisol, a stress hormone. The best way to check that is in saliva and doing a 4-point test starting in the morning before you even turn on the lights all the way up until around midnight. That really gives a sort of a baseline in terms of cortisol function, which is at the cornerstone of all endocrine disrupting problems. Estrogens, including estradiol. Yes, men, you do have some estrogens running around in your body, and they do play a vital role. Know that testosterone peaks at around 8 a.m. and yes, there's another peak at night, but the best time to measure testosterone, if at all possible, is at 8 in the morning. So, having a 3 o'clock afternoon office visit and getting your lab drawn then is going to give somewhat of an inaccurate or false impression of what testosterone levels are really doing in the body. Some basic chemistry, obviously checking blood sugar, checking kidney function, electrolytes. Lipids are important as well in terms of heart and vascular disease. And then hemoglobin A1C, this is a measure of what a person's blood sugar has been doing for the preceding 3 months. It's a way that we really track diabetics and is used as one of the diagnostic criteria for assigning somebody the diagnosis of diabetes. There are some other possible tests. So ultrasound is using sound waves, and it's a way to assess the blood vessels or the blood flow in the penis. And so what's done is a pre-test measurement using ultrasound, and then an injection of PGE1 is given, which is a vasodilator, and then the ultrasound test is repeated. And there are some baseline standards that can really help determine whether or not a pure vascular cause is present. There's some vibratory testing done, which I've never personally seen done, but the literature shows it's a way to check for nerve conduction and nerve function study. Basically, a small little handheld vibratory device is placed on either side of the penis, and the patient responds whether or not he can feel it or not. This is probably more key for people with nerve damage and diabetes. Vibration sense is one of the things that disappears in diabetics. That's one of the things we assess, checking their fingers and toes and legs, is a loss of light touch sensation, pinprick sensation, and vibration sensation, which signifies nerve damage. There's a nocturnal tumescence test, which is basically a nighttime erection test. A small little device is worn around the penis and attached to the leg, and in normal REM sleep, rapid eye movement sleep, erections should occur. And so if a person is having problems with sexual health and sexual function and they're not getting any erections at all during REM, this is certainly a validated tool to determine potential future directions to address this problem. Angiography, this is basically a study of how blood is flowing into the pelvis and penis. As I talked about in the previous section, prior trauma, difficulty with blood flow through the pelvic arteries into the penis, and other injuries can certainly affect blood flow and impact negatively the ability to get an erection. So angiography certainly can play a role in a person who's maybe had some catastrophic pelvic fractures, crush injury, car accident, things like that. What I want you to take home from this, that if a person's having problems with erectile or sexual dysfunction and they're not getting the desired result from their current therapy, it really behooves them to go back to their provider, their healthcare practitioner, and ask about some testing and some further exploration to make sure that something simple like an endocrine problem or undiagnosed diabetes is not missed.